In other news, a community in Oyo State has shown how collaboration between traditional leadership, government officials, and non-governmental organizations can help tackle Nigeria's open defecation crisis. This comes as the federal government, through its Clean Nigeria campaign strategic plan, wants to eradicate open defecation by 2030. Olalekan Akindoju has the details.
Araromi Akperin is in our local government area of Oyo State, and this small community was declared open defecation free in 2021. According to the wife of the town's monarch, Olori Rebecca Obisheson, this milestone was achieved through the leadership of her husband, Oba Mudashiru Obisheson, community mobilization, and the intervention of the Oyo State Ministry of Health.
Many people like these toilets. And they are praying for health care people and Kabiyesi Alararomi of Araromi. They are praying for him.
Nigeria faces a severe open defecation crisis, with around 48 million people practicing it, leading to significant health and economic costs. Some of the challenges include a lack of access to sanitation facilities in public and private spaces, and the need for sustained funding and community involvement. It is in a bid to help end this menace that the United Nations Children Fund, UNICEF, and the Oyo State Ministry of Information convened a 2-day media dialogue on accelerating actions to improve urban water, sanitation, and hygiene (WASH) in Nigeria. According to Monday Johnson, WASH specialist at UNICEF Lagos Field Office, rapid urbanization in Nigeria is overtaking sanitation infrastructure, worsening open defecation, and exposing millions to preventable public health risks. He identified the lack of an urban sanitation coordination framework as a key governance gap and called for immediate reforms to strengthen institutional and human capacity.
Generally in Nigeria, the WASH sanitation access in urban centers are not optimal. Now, most of the governments in Nigeria do not have a specific strategy that can address urban WASH in all ramifications. We need to ensure that all the people that are living in urban centers are taken care of when we are planning our sanitation strategies.
As part of the media dialogue, journalists paid a visit to Araromi Akperin in Onara local government area of Oyo State to learn how the community's success story can be a model for other communities in Nigeria. Oba Mudashiru Obisheson, the Alararo of Araromi Akperin, noted that although residents of the town initially complained about the change, they later realized the benefits of ending open defecation as their state of health significantly improved.
Somebody will dirty, so many things will enter their body, which we don't want it. And those people, they like us. When they come and see us, and we tell them to go out, so let them know what is happening. And really, our people, before, they don't understand. But now, if somebody needs and is there with himself will be happy.
The siting of toilet facilities at the Islamic Mission School in Araromi Akperin has also helped to increase school attendance. A teacher in the school, Mrs. Omolara Oyelude, said many girls now have more confidence and find it easier whenever they want to relieve themselves or during their menstrual cycle.
But now, in fact, our students are happy much because every day see the toilet.
Earlier, UNICEF Communications Officer Blessing Ejiofor reiterated that access to safe water, adequate sanitation, and good hygiene is a fundamental human right, particularly for women and children. She urged journalists to use their platforms to advocate for stronger policy action and accountability. Nigeria's revised Clean Nigeria campaign strategic plan will mobilize efforts to declare all 774 local government areas open defecation free by 2030. However, to achieve this important goal, there is a need to significantly increase the current rate of progress. Olalekan Akindoju, Western Spring Television News.